Right. So it all started when she started having difficulty in hearing. The left side is not working.
Felt dizzy every single month, every day. I want to throw up, and I had headaches so many times every day. Even at night, I wake up, I felt like wanting to throw up every single time. And my balance is off.
Hello, welcome back to Profiles in Patient Courage. Today you get to hear the story of a 20-year-old with an acoustic neuroma. Now, I did her surgery a year ago, but she presented very dramatically. For some reason, these tumors in adults, they can grow very slowly. I watch many of the patients, but in younger patients, for some reason, they present with huge tumors and they can cause florid symptoms. In this case, Alyssa has a large tumor. It's compressing her brain stem. Her brainstem is essentially squashed to the other side. It's blocking the fluid pathways, and I might have to put a ventriculoperitoneal shunt, which is a separate procedure where I drill a hole, put a tubing down into her abdomen. Listen to the end to find out whether I had to do that or not. All right, this is Dr. Lee with one of my favorite patients from a year ago. And Alyssa Martinez, who had a really dramatic story. And if you want to kind of give some of the story, what happened to you?
So what happened to me is that I felt dizzy every single month, every day. And I felt like I want to throw up, and I had headaches so many times every day. Even at night, I wake up, I just felt like wanting to throw up every single time. And my balance is off.
So headaches are so common. So many people have headaches, but having headaches and nausea and vomiting, that is very scary. And so then you went to the emergency room, and actually the parents are going to tell the story of what happened.
Right. So it all started when she started having difficulty in hearing. We went to a hearing doctor, couldn't find anything. The left side is not working. So he finally told us to have an MRI. And then that same day when she was diagnosed that she has this tumor, we were told to go to the emergency for a shunt because there's fluid in her brain, and she has to go through this huge surgery. And Dr. Lee, we're very lucky to have him because he took the time the whole day of taking and nitpicking the humongous tumor of Alyssa.
There are many approaches for acoustic neuromas. The least invasive would be gamma knife. More invasive would be surgery. And among the surgeries, I can do a translabyrinthine procedure. I can do a retrosigmoid procedure. And for these large tumors like Alyssa's, there's different options. For all the cases, though, I always use a microscope, and I work with my ENT colleagues.
And now she's all good, and she's like new human being.
Yeah, and I went, and we noticed that. I mean, she's more communicating with her siblings, being vocal to us, making social media.
Yeah, so Alyssa had a very difficult problem, a large tumor, one of the largest acoustic neuromas that I operate on. And she also had water building up and pressure building up in her head. And so although other practitioners had told her that she might need a VP shunt, we were able to do the surgery. She didn't need a shunt, and she's doing great. And what are you doing now these days?
I am in college, community college, and I work part-time at Walmart.
Well, we look forward to many, many years of just great life. All right, well, thank you. Closes this episode.